All righty. Good morning, everybody. Welcome to an Allstate monthly product training. Kind of out of the blue here. We've had a pretty crazy week. We are excited. Short-term medical is back. Expect we're going to have a lot of people in this training today. I am recording it, so we'll definitely be able to get it out to the masses anyway after this. And please believe there will probably be a few more of these trainings up and coming over the next weeks to months here as we're ramping up for open enrollment. So good morning or afternoon, depending on where you're at. Very exciting times, but as Aerosmith was letting us know, we are back in the saddle again. We got short-term medical back right in time for open enrollment. So pretty exciting stuff here, guys. And we're going to go ahead and get in this training for you. So the chat is open. If anybody has any questions, anything like that, you could definitely pop in the chat. I imagine I'm going to answer all of them or most of them during this training anyway, but if you need, that's what that's there for. But with that, let's go ahead and get this thing fired up and underway here, guys. All right. So short-term medical for half of you in this training right now, because I recognize names. Half of you've sold it before. You know what it is. This is going to be a refresher course. You're going to be like, awesome, Nick, check my boxes and be ready to go. For half of you guys, you've probably never sold it before. And you're like, what is this product, Nick? What are we going to do with this? And so I'll try to meet both groups of people where you're at and make sure that we're training this appropriately here, okay? Now, forget all the bullet points on this slide. Let's talk about why short-term medical is so important and is going to be so important for us, okay? So guys, for years in this industry, short-term medical was our bread and butter here on the brokerage side, okay? So what that means, guys, you're going to always run into customers that don't get a subsidy and are going to have to pay full price for Obamacare, right? And those customers are going to be calling you, begging you for options because most of our competition out there is a captive agent that can only sell them this Obamacare plan, right? And so short-term medical has always come in as the alternative, both on price and on product. It's a strong nationwide PPO network, okay? Great deductible options and great price point for our customers. And so when you put all that together, it becomes a no-brainer as an alternative to Obamacare if somebody's not getting a subsidy. Well, also good news, this is probably going to be one of the biggest open enrollments for short-term medical in recent memory. If you guys have heard rumblings going around the industry, there's about to be a redo on how subsidies are calculated for Obamacare at this next open enrollment. So if you've heard the rumblings, there are a lot of customers that are currently getting subsidies that will not be getting subsidies here in a couple months when they apply for their Obamacare, or they'll be getting significantly scaled back subsidies. Those customers are not going to be very happy when they see the new prices on Obamacare. This is going to work amazingly well to save you and save a lot of your customers as actually a stronger option network-wise and probably come in there cheaper for them. So it's important that you guys are aware of what's coming down in our industry and know how and when and why to sell short-term medical. It's going to be very, very important. Okay. Before we get going, there are 3 states I want to call out, okay? So in the majority of states, we just turned the switch and turned it back on to exactly how it was before Biden's ruling last September. So how you guys were writing this stuff in the states in which you were writing this stuff all stays the same or reverts back to what it was about a year ago, just over a year ago. There are a few state call outs. One of them, thank you, Joe Davern in the chat. Illinois, Right now, state legislators in Illinois are playing hardball. We might not get short-term medical back in Illinois. I'm in California, so we've never had short-term medical. So Illinois, welcome to that side of politics, right? Uh, Two other states to call out, Montana and Texas. Those two currently are not quoting in the quoting platform due to a holdup on the state's end. However, we are confident that those two states should be able to be quoted in the very near future here. We don't see those holdups as anything detrimental, but Texas and Montana specifically, we are not seeing it in the quoting platform immediately, but you guys will be seeing those in the very near future. Okay, perfect. With that, let's jump into it. Okay, so remember, guys, that okay, all this legal jargon here, what this is actually saying in layman's terms. Okay, this is saying do the right thing. Okay, if you're selling your customer a short-term medical plan, there's no need to tell them that it's Obamacare and lie to them. Just tell them what they're buying. And that's all this is saying. If you're selling short-term medical, don't misrepresent it and tell your customer that it's an Obamacare plan. Saved you guys a lot of reading right there, okay? Cool. So we're going to get into the plan, how it works, the different levels of it. I'm going to tell you guys how we sell it, what we don't sell, so that you guys are equipped to go out there and sell, okay? So office visits for everyone. Deductible is waived on urgent care visits. I'll spend more time on that in a little bit. There are options for prescription drugs. There's a copay level plan. You guys can start the insurance as early as tomorrow. I mean, it is already live in the quoting platform. You can literally start it as early as tomorrow and run coverage for 12 months, and in some states back to 36 months already, okay? So we'll go ahead and walk through what it looks like. There's 4 main tiers or levels to the regular short-term medical, okay? The first tier or level is called the copay enhanced. Now, copay enhanced is the most expensive level, and just based on what y'all have been selling over the years, this is not our best seller, okay? I'll call out the call outs on it. So one, obviously, it comes with copays, and that'll be on the next slide, so I'll show you what that is. So that's to help the plan feel a little bit more normal, or like normal health insurance for our customers. So that's why we created this level. If I'm going to sell it, I personally like selling 100% coinsurance. It's just easy to explain, so it's easy to sell, right? Imagine you're talking to your customer. You just say, hey, Mr. Mrs. Customer, the way I've put this plan together for you, you've got a $6,000 deductible. After you meet that, all of your medical bills are going to be taken care of at 100% by the insurance company, up to $5 million this term. So this year or 3 years, whatever the term might be, okay? Easy to explain, easy to sell, right? Instead of going into, Mr. Mrs. Customer, the way I've put this plan together for you, we have a $2,000 deductible. But now, after you hit that $2,000 deductible, you're now going to trade bills with the insurance company. They're going to cover 75% of bills. You're going to cover 25%, all the way up until you have spent another $7,500. Then after you've spent that additional $7,500, now the insurance company is going to kick in and cover everything up to $5 million. You see how that's just a little bit too wordy, a little bit too mouthy going on there? Give your customer too many numbers floating around, opportunity to lose a sale. So I like 100% coinsurance, just simple, quick hitter. But that is the copay enhanced version. Again, it is our most expensive version level of plans out there. This is what the copays look like. So it's a $40 to go to a primary care physician, $60 to a specialist, okay? And then $10 generic drugs. That $3,000 benefit is kind of like its own drug deductible. That does not count towards the main plan deductible, okay? So that's how this plan works on the copay enhanced. Besides the copays, nothing super stellar about it, especially at the price point. The next level down is called the enhanced PPO. This is what the marketplace sells the most of. Okay, so this is probably what you guys are going to sell the most of. Now, again, I like 100% coinsurance. I don't know the tiers, Estella, but it's generic meds. I definitely don't know the tiers. I don't believe that was called out here. It's just $10 generic drugs. So I don't know what tier that would be, but it is generic drugs specifically. All right, on the enhanced PPO, one big call out. There's no more copays on this, okay? Vicky, they are not unlimited on there. It is one primary care, or sorry, one specialist, two primary care physicians for an individual, and then for a family, it's three that you can go to annually in a year. Good call out there. Good question. Okay. All right. Enhanced PPO, the one you guys will be selling. Okay. The two that are sold the most of in the marketplace is $5,000 deductible 100% coinsurance and $10,000 deductible 100% coinsurance. One big call out, far right coverage period maximum. That has dropped from $5 million on the copay level to $1 million on the enhanced. Most of you guys still probably haven't had a customer hit $1 million in medical bills in a year, or very few, very rare, but it is a call out that you guys want to be aware of. If our customer is having a rough year on this plan and they're getting close to that $1 million, no big deal. We just move them over to an Obamacare plan at the next open enrollment. Okay, that's kind of the simplicity of these plans. But $5,000 deductible 100% coinsurance or $10,000 deductible 100% coinsurance are the two that the market buys the most of. Good price point for value of the product that we are getting. If you guys are really bold agents, there are a few out there, definitely a couple in this chat that I'm aware of. You can also sell a $25,000 deductible 100% coinsurance. That's going to open up a lot of budget in there. And then you can add really good supplements to kind of take care of everything else. So that is also an alternative play. We do see a lot of the 5,000 80/20 sold as well. One call out, these slides work a little bit different than like if you're reading an ACA plan. So this is a $5,000 deductible, and then there's an additional $5,000 out of pocket. So this is a separate, so it's really $10,000 out of pocket maximum if that's how you guys wanted to read this. But you would hit your $5,000 deductible, then you would go on an 80/20 split for another $5,000 up to 100%. Okay. We'll get over that, Stephanie, but yes, you're absolutely right. And Bruce, of course, all of these are child only available as it's always been. The plans, guys, nothing has changed on these plans from how you guys sold them for years. Okay, so for my older agents in here, however you sold it before is still going to work, I assure you. So yes, child only are cool. All right, that is the enhanced PPO. Again, top sellers by a long shot, in our company. Again, it's just the right price point for value being provided, okay? This is the next level down, the Essentials PPO. This is our cheapest one, and as they say, you get what you pay for, right? So this is not something you're going to sell a lot of. This is for maybe the 20-year-old kid that is paying insurance on his own. His parents aren't helping him with it anymore, and he can't afford really anything. He doesn't plan on really going to the doctor or anything, right? Just needs something bare bones. Well, here it is. You could sell him one of these. It is a 60/40 coinsurance after they hit the deductible up to another $7,500. And then you notice the coverage period maximum's only $250,000. So not a sexy plan by any means, but these are the budget plans, right? These are the low-level budget plans that you guys might sell in certain situations, okay? And then the fourth level that I promised you is actually one of the more expensive levels because it is the guaranteed issue level. Now, for those of you newer to insurance or newer to this side of insurance, when you hear the word guaranteed issue on private market products like short-term medical here, okay, it means anybody can get the plan. Congratulations, you can get the plan, but it is different from that guaranteed issue on Obamacare, right? When you hear guaranteed issue on Obamacare, it means, hey, come on, get the plan. We'll pay for all of your stuff you got going on. When you hear guaranteed issue here on the private market, it means, hey, you can get the plan, but we're not paying for any of your pre-existing conditions. Okay. Look, whether or not we gave you this insurance, you were paying for all your pre-existing conditions on your own anyway. So you can get this insurance regardless of your pre-existing conditions. We're just going to pay for new stuff, right? You get the flu and you need to go to the doctor. You fall down the stairs, roll your ankle, right? We'll pick up that stuff. But whatever pre-existings you had, we're not going to take responsibility for that. And because you are risky and you have pre-existing conditions that would otherwise maybe knock you out from getting this plan, it's going to be more expensive, okay? But great deductible options, $3,500 or $5,000, both great deductible options. It is going to be a co-insurance there. And then look, that coverage period maximum is only $100,000. So not amazing, but it's there as a Band-Aid for someone. These are truly more of the Band-Aid plan, right? This is really for somebody, let's say you get a call tomorrow and it's somebody that has some expensive pre-existing conditions, but they don't have a qualifying life event to get Obamacare, okay? Charles, I'm getting that right now. So you would sell this to somebody tomorrow and give them 4 months of it, right? And say, look, this is going to get you insurance for anything that may or may not happen between now and January 1st. And then during open enrollment, we'll enroll you in an Obamacare plan and get you going. Okay, so that's kind of the situation you would sell this in, really as a Band-Aid for somebody that has some pre-existing conditions, but for whatever reason cannot get Obamacare right now. You would give them this as a Band-Aid for a few months to get them to January 1st when their next Obamacare plan could start. Okay, good question. 1 second here. Cool. So guys, we try to keep everything simple. Simple leads to sales, right? And so we want to keep it simple for y'all, the agent force, so it's easy to explain. But then we also want to keep it simple for your customers so it's easy for them to understand, right? So out of network, how does out of network work on these plans? Let's keep it simple. If your customer goes out of network, they can expect to pay about double. Just keep it simple, okay? Family deductible, okay? Now, see how it says capped at 3. Let me go back a couple slides to make this make sense though, okay? So let's say we sold the $5,000 deductible 100% coinsurance, okay? $5,000 deductible 100% coinsurance. It says it's capped at 3 family deductibles. So how does that work? So if Nick gets the plan himself, I have a $5,000 deductible. After I've hit that, I'm at 100% coinsurance to $1 million, easy peasy. Now, if Nick decided to add his wife on the plan, okay, we now have 2 deductibles. Nick has a $5,000 deductible and my wife has a $5,000 deductible. So the exposure for the total of us is $10,000, but Nick can only go to $5,000. My wife can only go to her $5,000, okay? And then we're on 100% coinsurance. And then what if Nick decided to add his children to the plan? I've got 2 kids, a third on the way. It doesn't really matter how many kids you have. Children are the third deductible. So whether you have 1 kid or you move to Utah and have 10 kids, that's its own third deductible. So me on it, $5,000, my wife, $5,000, and then we add my kids on it. That's another $5,000. Now we have potentially a $15,000 exposure, the only chance you're going to really hit that 15 grand, since they're separate deductibles, right, is if like the family got in a pretty bad car accident together, right? We're all in the car. Now we all might trigger some medical bills or something like that, right? But you all have your own separate deductible. So it's a rare situation where the max is going to be triggered, but you do need to be aware of how that works. Okay. That is what this bottom box was saying there. Okay. There's a question. Can you be clear? Is there a chance Illinois will offer the previous STM? I am unaware of Illinois. I am not hearing confidence in the industry on Illinois right now, Calvin. So my assumption is no, Illinois might be coming more like California, where it's just impossible to do short-term medical there. It's, Los Angeles and Chicago love being like each other. So my assumption is going to be we're not going to see it back in Illinois. That's the rumblings I'm hearing, but I don't have concrete on anything like that. I'm not in those cabinet meetings. Nick, can you confirm for doctor visits, even though you don't get any outside of the copay plans, you will get a pre-negotiated? Yeah, Steve, that's absolutely the case. And I'll go over that actually on this next slide. Good question. Go Bears. I'm just really sorry about your quarterback, and I'm a USC fan, so that's rough. So doctor's visits. They applied a deductible and co-insurance. So the question was just asked there by Steve. You can go to the doctor. You're just going to pay whatever the doctor's bill is, minus the network discount and everything like that. Okay. Now, we don't want to have our customers going to the regular doctor, though, on these plans. Okay. This is the juice in the short-term medical plans. And truthfully, this is why so many people did not sell the copay level. They just sold the enhanced level. So check this out. On the urgent care, unlimited visits, $50 access fee to go to urgent care. But check this out. The deductible is waived and the remaining cost applies to coinsurance. So Nick, what if they're on 100% coinsurance? Well, that means they just pay a $50 access fee to go to urgent care. So for a lot of years, and hopefully you guys continue this, you just treat urgent care like a $50 copay, assuming you guys sold the 100% coinsurance. And this is why the 100% coinsurance levels were sold so much, okay? Now, the reason that we do this, urgent care is actually one of the most affordable medical billing platforms out there. So we are trying to educate customers to go to urgent care. It's cheaper for us, it's cheaper for them, and it's efficient. They're on literally every street corner next to Starbucks and 7-Eleven nowadays, right? So try to get your customers to go to urgent care. It's $50 access fee there. The rest applies to coinsurance, which if they're on 100% coinsurance, you're good to go. Now, one call out on that. They can still incur additional costs at the urgent care depending on what they go there for, right? If you go into the urgent care and they need to submit something off for labs, well, you're still going to need to pay extra for the labs, okay? The labs are a separate bill that come through. So the urgent care visit is what's $50. And then depending on what happens there, there could be additional bills, but it could be just $50 depending. Now, let's go ahead and read emergency room here. Kind of starts similar. It's unlimited visits, $250 access fee unless admitted. Ooh, okay, so that's a little different. It's an access fee, but it says unless admitted. And then the last line applies to deductible and coinsurance. Ooh, so what is this saying? What this is actually saying is if you go to the ER, we're going to make you pay everything that the ER bills, and we're going to penalize you and slap an additional $250 fee on there unless you're admitted to the hospital. So how does that read? That what that's saying, guys, did you know the majority of people in the United States go to the ER for the flu? True story, still happens to this day. almost any time you go to the ER, you are almost guaranteed to see somebody in that waiting room that's there with the flu. Almost guaranteed, okay? We are trying to keep people away from the ER, right, Andrea? We are trying to keep people away from the ER because that is the most expensive medical billing platform out there. So we're going to make it more expensive. We are going to charge you on that, okay? $250 unless you actually went for an emergency and you're admitted to the hospital. So really my rule for my customers is, look, if you can drive yourself to the ER, probably just drive yourself to urgent care, okay? It's probably not that serious of an emergency if you can drive yourself, okay? I'm not, so the question from Rachel, are these copays for the copay enhanced and the enhanced PPO? No, so these aren't even copays here. This is the back end, how the plan works on the back end. If you're on the copay level, you'll follow those copays over the doctor's visit. See how it says on doctor's visit, it says copay option with copay enhanced. You would then follow the copays there. This urgent care works for both levels, but most smart agents don't have their customer pay more money to be on the copay enhanced level. Just go on the enhanced level and teach them to go to urgent care, okay? And then the question on would x-rays be covered? X-rays is an extra test. So no, you're going to pay for x-rays, okay? Unless, yeah, actually what Gail said, unless they do have it all in shop and facility, but oftentimes you're going to get an extra bill for that, okay? And that's like the diagnostics and lab. That's pretty much what that is. Applies to the deductible and co-insurance. So you're going to get billed for that, okay? Cool. All right, this is the extra slide on back end stuff. This is a little bit more simple. This is more like normal insurance, okay? Inpatient services, that's hospitalization, right? That's just going to apply to deductible and co-insurance. That's kind of standard insurance, right? Outpatient services, same thing. That's going to be your outpatient surgeons, anesthesiologists, all that fun stuff. The only call out is if you get the cheap plan, the essentials level one with the 60/40 co-insurance, that one is capped at a $15,000 limit for outpatient services. So we need to call that out. But for the most part, you're going to be selling the essentials, and that, I mean, not the essentials, you'll be selling the enhanced, and that won't apply, okay? Child immunizations is a first dollar benefit. That means we pay for child immunizations, right? That's what that means for those of you new to insurance. First dollar means we pay for it, okay? So child immunizations are covered, but adult screenings apply to deductible and co-insurance, meaning it's going to be billed normal, all right? One of the favorite things about Allstate's short-term medical plan is there are two network options available, either Aetna or Cigna, okay? Both of these are massive nationwide PPO networks. Now, you don't get both of them. Your client doesn't get both of them, okay? You choose either or. Now, when you're running a quote in the quoting platform, it will default based off the zip code that you type in. It will default which network it thinks is stronger on that zip code, but that doesn't always mean that's the case, right? The general rule of thumb I see is the more rural your customer lives, Cigna is going to be stronger. And in the suburbs, in the city, Aetna is going to be a little bit stronger, okay? That's just kind of general rule of thumb that you will see. Yes, they are not the same cost networks either. Usually there's a cost difference of, I estimate it out to about $25 per member, but anywhere from $25 to $50 per member, generally speaking, depending on the state, if you're moving networks. But sometimes if that's got your customers, doctors, and hospitals in it, they'll pay the extra, right? This is the state availability list, okay? These are the states that it is live in. Again, these are the states that it was live in. Again, the call out, Montana, not live yet, but we are very confident that that's coming right around the corner here. And And then here's the second set of slides here. Same thing with Texas. Not live yet, but we are confident that'll be coming soon. Okay. Yeah, you get what you vote for, right, Steve? All right. Cool. Now, what I trained you guys on right there is original short-term medical. That's going to be the majority of states that you guys are going to be selling it in. There is a small list of states, and I'll provide it to you shortly, don't worry, that have HSA compatible options. Okay. What this means is these plans meet the government's requirements for your customer being eligible to put money into an HSA account. Let me be clear. Allstate does not manage the HSA investment account, okay? That is done through their financial institutions, okay? These are short-term medical plans that meet the government's requirements for a high deductible health plan to where your customer can then put money into an HSA compatible plan. Okay, I want to be clear on that. So if your customer already has an HSA account, they can sign up for one of these short-term medicals and they can continue depositing into that HSA account. If they don't have one, tell them to get in contact with their bank or whoever they invest with if it's different from their bank, okay? These are all fairly the same. I'm going to do a couple call outs here in the end, but this is what the HSA level ones look like. Remember, to be HSA compatible, they have to be high deductible health plans. So the levels are a little bit different. For me personally, 100% coinsurance again. So I like to sell the $6,000 100% coinsurance, but you can also do the $7,500 if it's better budget for your customer. Okay. Similar to the enhanced PPO version, it is $1 million coverage period maximum. So for simplicity for us as the agent force, sell the enhanced PPO and sell the HSA. You just know it's going to be $1 million coverage period. You don't get confused with, oh, what did this level drop to and all this, and then keep the 100% coinsurance. Okay. A few things are going to change on the back end here. So I'll call out what is changing. Okay. Out of network stays the same, double the in-network amount, but the family deductible is different now. And so for some customers, this might be a differentiator that they would go the HSA over the regular short-term medical, right? This one is capped at 2 family members. So it doesn't matter. It's just husband. As soon as wife or children get added, it's capped at 2. So it works the same. Just regular short-term medical can go 3 family members on the deductible. This one, 2. Simple enough, okay? Then we're going to get a little bit different over here. This one does not have the urgent care benefit, okay? Notice urgent care and ER, we're not allowed to put access fees on there under these rules for HSA. So it just applies to deductible and coinsurance. Actually, this whole screen just applies to deductible and coinsurance, meaning they're just going to pay for it, right? Whatever it's billed with the network discount, okay? On the back end over here, there is one big call. Everything's going to be the same except the very last one at the bottom. And this is sometimes a selling point. On the regular short-term medical, adult screenings and immunizations apply to deductible and coinsurance. They need to pay for them. On the HSA level, adult screenings and immunizations also work like child immunizations, and they are first dollar, meaning they are paid for. So for some customers that type of stuff is important to them, you might go the HSA route over the regular short-term medical, okay? HSA only uses the Aetna network, so we keep it simple on you. It's the same Aetna network that's used on the other short-term medical. You just don't have the option to switch between Cigna or Aetna. That doggy is definitely hoping a potato falls off here. All right. These are the states it's available in. Like I said, much less states. Kind of keep it simple there. But that is where you would find the HSA eligible ones. Again, give Texas a second. Yeah, yeah, Vicky, those are adult screenings. Absolutely. So Texas should be coming right around the corner. That's why we have it on the slides. We're not scared of that. We are hearing confidently that those will be coming on, okay? All right. Eligibility, age. These eligibility questionnaires, guys, these are for all of the short-term medical. So if you're newer to short-term medical, okay, remember, one of the reasons that this is so affordable in comparison to Obamacare, our customer has to pass a health questionnaire. Not everybody can just get it, okay? They have to pass a health questionnaire. So you can write it for a child as young as 2 months old, 60 days, and then all the way up till you age into Medicare, okay? Here is where we start getting into some of the questions that we need to pass. So if you're over 300 pounds as a man and over 250 pounds as a female, you can't get the plan. You can get the guaranteed issue level, but anything that goes wrong that they can tie back to your weight, we're not going to pay for. Understand that, okay? 300 pounds of male, 250 pounds of female. Before one of the ladies comes in this chat, it happens all the time, and the ladies are like, Nick, but what if my customer is Dwayne The Rock Johnson? 6'6", chiseled, but he weighs 340 pounds. Look, I understand Dwayne is probably one of the most healthy guys in America. Maui in Moana would be how my daughters know him best, but he's unfortunately over the 300-pound limit. He can't get this plan. It's just simplified underwriting, guys. We don't make the rules. This is just what the rules are. So unfortunately, Dwayne, this one, it won't be the right option for you. We'll have to look at other alternative options for your health plan. I'm sure he could afford additional alternative coverages. Yeah. Now, where I will draw the line here is, like, let's say you're talking to a customer and it's a guy and he says he's 305 pounds. Okay. On that one, I would ask him a follow-up question. Say, what does it say on your driver's license that you weigh? Right? Guys, on my driver's license, I'm at least an inch or two taller than I am, right? I think on my high school weight, I'm probably like 160, 160, definitely 20 pounds lighter than I am right now, you know, all that. So you can ask them that to get a ballpark of where they're at. But the reason being on this, guys, is if they're close to 300 pounds, you'll probably be okay. But what's going to happen is when they submit a medical claim, right? We're going to go back and look at their medical history. And so if previously they were 280, fine. We all go up and down with our weight, right? Any given month, right? So we understand that. But if we go back and pull a medical history, and for the last 5 years, he was 400 pounds, then 380, then 360, 340, and now he's 305, let's just hold off a little bit longer on writing this plan until we get under 300, right? You're right there. I'm pulling for you. Call me in a couple weeks here, right? Because you don't want to take that risk if his whole medical record shows that this guy's never been under 300 pounds. But if it's like most of us and we're going like this, and hey, just this week he's teetering on the wrong side of 300, you should be okay, all right? You're going to always read this bottom paragraph to your customers during the application, okay? Any false, inaccurate, or misrepresented statements on the enrollment form may result in claim denial, premium changes, or contract rescission. What that's saying, guys, and they're going to sign the app to that. Just saying, I don't need to get in the weeds if you're lying to me. Just know if you're lying to me, we're not paying for it, okay? But other than that, I'm not going to fight you, okay? Lynn Lewis asked, let's say a customer has short-term medical in Florida and they traveled to California, would they get the same benefits? It's a nationwide PPO, Lynn. So yeah, they can use the plan in any state that they're in. Now, if they moved to California, no, the plan's dead. They're not going to be able to have it. We would not renew them in the state of California because the plan doesn't exist in California. But it is a nationwide PPO, so there will be doctors and hospitals when they travel. Okay. Dave asked a pregnancy question. You're segueing perfectly to my next slide. Dave probably hasn't sold short-term medical before, so I can understand the question coming in. On short-term medical, as Steve just said, pregnancy is actually a knockout. You cannot get the plan if you are, that first bullet point up there, pregnant, an expectant parent, in the process of adopting or a surrogate pregnancy or undergoing infertility treatment. You can't get the plan. Sorry. Now, these questions are yes/no questions. If your customer answers yes to them, they can't get the plan. It's that simple. Again, simplified underwriting. This is how we keep the plans so affordable. Okay. Within the last 5 years, have they received medical or surgical treatment, consulted a healthcare professional, or anything around AIDS or HIV? Now, for me on that one, I go longer than 5 years. Even though it says 5 years right there, right? You got to think about it, guys. And now, I don't know, I'm not his doctor, but I assume Magic Johnson is still taking pills to this day, right? So look, it says, or had a medication prescribed or recommended. So if you get HIV or AIDS, to my knowledge, you're taking pills for the rest of your life. So it's not really a 5-year. That's just a knockout in my book, right? Unless they literally have been HIV free for over 5 years and don't take pills or don't take anything. So the husband whose wife is pregnant, he can get it. No, he's an expectant parent. So unfortunately, Laura, he couldn't. Now, the reason on this, guys, just so that you're aware of how this works, okay? There is a federal law that when a baby is delivered, it rolls up to the parent's insurance automatically, okay? And so short-term medical, this is going to sound a little bit ugly and bad, but I'm just being blunt with you guys. We don't know what that child is coming out with, right? We weren't able to ask this health questionnaire to the child. So we are erring on the side of caution, and we're saying we'll pick up that child when they're 2 months old and we know a little bit about that child. But we don't want, and again, this is going to sound ugly, but we don't want a child coming out with cerebral palsy. And yeah, that rolls up to us. Federal law, that rolls up to the parent's health plan. Now we've got to pay for it. Okay. So that's the reason behind it. And that's, again, how we're able to keep costs so low. Okay. And then in the last 12 months, has an applicant been recommended or scheduled for treatment, follow-up, or surgery that hasn't been completed? Well, we're not picking that up. Or have they consulted a healthcare professional for signs or symptoms of a condition or a diagnosis, but we don't know what it is yet? Well, we're not picking that up, right? So that's one. And then here is the big catch-all, okay? In the last 5 years, has an applicant received medical or surgical treatment, consulted a healthcare professional, or has medication been prescribed or recommended for this laundry list, okay? Now, similar to the HIV one, right? Some of these are more than 5 years in my book because, again, it's consulted a healthcare professional or medication been prescribed, right? So, for example, if you had cancer previously, for the most part, you're going to be getting a doctor doing checkups on you on that for the rest of your life, right? You could have had childhood cancer at 3 years old. You could be in your 30s now. If your doctors are doing their job, they're running skin grafts on you. They're asking you, hey, anything going on here? They're running blood tests looking because you have had previous cancer, right? So their medical records is going to show that they consulted a healthcare professional for that. So some of the more serious ones, it's probably more than 5 years just based off of how those are handled in the medical industry. But some of them, it's a 5 year, right? Like alcoholism, alcohol abuse, drug abuse, right? You go get help. And if you stayed sober, you're probably not meeting with a doctor every 5 years after that. Okay. Yeah. Bruce nailed it, right? There's people that stay on diabetes or pre-diabetes and for a long time, right? And so you guys got to be aware of that. These are knockouts that'll keep people off of these plans. But again, this is why these plans are so affordable for the people that can qualify. Okay. That is your health questionnaire. Now, here's an additional questionnaire. This one gets asked at the very beginning. So if you're in the quoting platform, you go to short-term medical, there's like 4 questions at the very beginning. It's trying to see if they can qualify for preferred rating, okay? So on preferred rating, they can get the preferred rates. I'm not reading all that. On if they have had insurance coverage for 9 of the last 12 months, they have not used tobacco or nicotine products in the last 12 months, have not had a DUI or more than 1 moving violation in 2 years. They do not own a motorcycle, have not been treated or prescribed medication for blood pressure, cholesterol, anxiety, or depression. Well, that knocks out half of America right there. And then this one has a different weight requirement, 240 for male, 190 if female. If they can pass these additional questions, they will get a nice discount on their health plan, okay? And so we try to force this question up front. Yeah, 20% is the correct answer. We try to force that issue up front just to see if customers do or do not qualify, okay? The preferred rates are only for the adults on the plan, the primary or the spouse. The children do not get it, okay? But if you're writing a family, one of the adults can qualify and one can't. That's totally fine. If one of them qualifies for preferred rating, we'll rate them down. You don't need both adults to qualify for it. So good thing to know there. All right, if you're in the quoting platform running quotes, it can get a little bit confusing on what is consecutive versus what is renewable on plans. And so I want to make this make sense to you guys, okay? So renewable plans are the ones you probably are going to sell more of because the market generally sells more of them, okay? So renewable plans, they're just going to have, like, let's say you're on a 3-year plan. You're in Florida and there's a 3-year plan available for you, okay? That 3-year plan is going to be a renewable plan, which just means it's just going to continue rolling year after year for 3 years, okay? That's how it's going to work for a renewable plan, okay? Now, there is a really cool option in there when you're running the quote. So if you're in there running the quote, actually, let me just show you guys real fast to make this make sense. So I'm running a quick Florida quote. So look at this. You see on the monthly over here, there's 24 months. That is considered renewable. So that'll just roll regular. And then there's 24-month rate lock. Same thing here at 36-month. That is renewable, but there is a rate lock option. I want you guys to understand how this works. 36 months just renewable or 24 months just renewable. Your customer is going to just continue rolling year after year, but they're going to get a rate jump next year and then year 3, okay? And it's going to be a market rate jump. So you could see a 20% rate hike. It could happen, okay? If you do the rate lock option, the plan is a little bit more expensive today, this year, but it evens it out over the 2 or 3 years. So you don't have that grumpy customer next year that got the 20% rate hike. It's instead going to just marginally move up on them, right? They're just going to go up a couple bucks and they're going to be fine. So I'll show it to you guys real fast. If I do a 36-month rate lock, let's do a $5,000 deductible 100% coinsurance. It's just under 800 bucks. $797 for the rate lock. If I do the regular, it's about 100 bucks a month cheaper, but cheaper today. Next year, they're going to get a 20% rate hike, right? That's about 150 bucks right there. So next year, that'll be about 850 bucks. And then year 3, it might go up to 1,000 bucks a month. Whereas if you guys write them on the rate lock, it's 800 bucks today. So yes, more expensive today, but next year it might be 810. And then the year after that, it might be 820, right? So just giving you guys an idea of how that works, what that looks like. Then there's this option up here, 2 12-month terms, no renewable. What that is, guys, that is our consecutive plans, okay? So the consecutive plans are going to work a tiny bit different. There is one benefit to them, but we don't sell a ton of them, I'll be honest with you. We sell more of the renewable, but there's one benefit to the consecutive. Consecutive is only 2 years available, and the big advantage is the coverage period maximum will reset. You are guaranteed the second year on the plan, but the coverage period maximum is going to reset. So that $1 million coverage period maximum on a renewable plan, they have $1 million over the 2 or 3 years. Okay. On the consecutive plan, they have $1 million this year and $1 million next year. Okay. But it's going to be more expensive, and it's going to be more expensive next year. Okay. Because you're requalifying next year, although you're not requalifying under underwriting. So they're guaranteed to get the plan next year, but you're requalifying on the rate. So the rate could have a significant jump. Okay. Now, both levels, consecutive or renewable, the deductible resets every year. Okay. It's a normal health plan. So it's a 1-year health plan. So your deductible will reset every year. Okay. And then pre-existing conditions, if it wasn't a major one, right? If it was, so I'll give you guys a good example. I have a bad collarbone. It was broken a decade ago, and I was talked out of surgery because I had a cheap HMO at the time. And so I still have a broken collarbone to this day. For me, that's not a knockout question, right? There's no question that we were asked in underwriting that's going to say, hey, Nick, you got a bad collarbone? No. So I can still get the plan. If I do a 2 or 3 year option, year 2 in this plan, so month 13, I could actually go get my collarbone worked on. Okay. That it's a pre-existing condition. So they won't take care of it for the first year. But since it's not a major pre-existing that would have gotten me booted off the plan, year 2 or 3, I could go get that worked on. Okay. Some people, it's a bad knee, rotator cuff, whatever it is. Just know after 12 months, you'd be able to go get that worked on. Okay. So hopefully that made sense. I showed you guys a little bit of what that looks like in the quoting platform, so you know what the difference between renewable and consecutive is. But for the most part, we sell more renewable. Okay. Andrea asked, doesn't that work with the renewable? Yes, it works with both of them. See, this says renewable and consecutive. So the farthest box on the right, that works for both of them. The expenses covered after 12 months. Yes. All right. Association. Ours is called Life Association. The big selling points of it, now it's not even a selling point. The association is just added on to the plan. It's legally required in some 40 states. But it does have telemed for life included, 24/7 access to a physician via phone or FaceTime, no additional cost. Okay. If they want to pay more, there's a fitness discount program for an extra $28 a month. I personally don't sell a ton of that because I sound like a used car salesman at the end. Oh, for an extra $28 a month, we could throw it. But if your customer is asking about gym memberships, things like that, that's an option available to them. The other big thing I like to point out here is the hospital and diagnostic facility negotiation services. I love that. When you guys have a customer service team that you or your customer can call into and say, hey, I got this bill from the hospital. I don't think it's right. Can you guys help me negotiate it down? They will. Morris, I answered that multiple times already today. Texas is not quoting right now. I've actually said that like 4 times during this training already. Texas is not quoting right now. Same with Montana, but it will be coming soon. Okay. And I don't mean soon like today, but it will be coming soon. Okay. Awesome. Here's your limitations and exclusions. So we are not going to pay for pre-existing conditions, except after that 12 months if it's nothing serious. We're not going to pay for expenses incurred outside the United States or its possessions or Canada, depending on where you're at to the border. Okay. We don't pay for maternity. We went over that. We're not going to pay for cosmetic services. So ladies, we're not going to pay for your boob jobs or lip fillers. Sorry. We don't pay for hazardous activities or occupations. So if you're a skydive instructor or you just decided to go skydiving this weekend, and let's not say the parachute doesn't open. Let's just say you land a little bit hard and break your ankle. What are you doing skydiving, dummy? Like, we're not paying for that. We're not paying for mental illness or substance abuse. We don't pay for workers' comp because you've got workers' comp to pay for that, okay? Eyeglasses, contact lenses, you can have a vision plan for that. And we don't pay for weight control either, okay? All right, for those of you newer to it, one of the big benefits of short-term medical, you can literally sign them up any day of the month. You could sign up for a plan today to start tomorrow, okay? So it's available all year round. Make sure you guys are getting their routing and account number. These are 3-year plans. Remember, in a lot of states, credit cards expire, routing and account numbers don't expire, okay? Just so you guys know, the payment will always be taken out the 1st to the 28th. So if you sign somebody up to start on the 31st of the month, cool, but the payment's going to be coming out on the 28th because February comes around every year, and so we need to adjust to make sure that we're not going to miss a bill there. So it'll adjust down to the 28th in any situation, okay? Laura asked, hey, so for the telemed visits, no cost at all? Or does that mean no additional cost to have added on it? So Laura, there is no cost for the telemed visits at all, okay? Now, the reason that it's worded a specific way, the association costs money monthly. Now, that cost is just rolled into the monthly bill of their health plan. So it's not like an additional cost your customer's seeing, but the association does cost about $20 a month on the plan. So they can't say it's free because they're paying $20 a month for the association, but there is no additional cost to use the telemed benefit. They're just paying $20 a month for access to it, okay? If a client chooses one payment for a 12-month plan and cancels month 6, do they get a refund? They would get a refund of anything that they did not use. Absolutely, although I don't really see people canceling if they paid a whole year up front. They're just going to take the insurance. But that would be accurate, yes. Okay, first thing, guys, if you have never gone to this website before, you can do a one payment for that, Steve. Oh, no, actually, Steve, you cannot do, you can only do a year at a time on that because we got to re-rate each year on that. Good question. All right, allstatehealth.com. You guys should bookmark this. Bookmark this. This is a great website for you guys as resources. Rachel, the prices I showed was correct for a 40-year-old male in the state of Florida. It changes based off of age and states, but the prices you saw me on my quick quote I ran for you guys was a 40-year-old male in Florida. So those prices definitely change based off of your age and your state. All right, allstatehealth.com. You guys can come here and click the agents and brokers tab. It'll have a link to our YouTube channel, so you guys can see trainings on these on these products through YouTube. It also has marketing materials, so you guys can print out brochures or trifold flyers, anything like that. It is Allstate. That's why it's called allstatehealth.com. Okay. If you go to the existing brokers tab, you can find doctors and hospitals in your network. You can help get claims forms or help your customers submit a claim. And you can also get access to the customer-facing website called myallstatehealthsolutions.com. Now, this one, y'all don't need to memorize. This is for your clients, and they will get it in the packet that comes in the mail, myallstatehealthsolutions.com. But this is where they can pay their bill, download ID cards, things like that, okay? Always, always, always bundle this stuff, guys, right? Just because I think short-term medical is a lot better than Obamacare, unless my customer is getting a ridiculous subsidy, does not mean there's still not an exposure there, right? They still have a $5,000, $10,000, $15,000 exposure. We need to be pairing it with Plan Enhancer. We need to be pairing it with some critical illness on there, maybe an indemnity plan depending on their budget. So always, always, always be making sure that you guys are protecting the out-of-pocket exposure. We're opening up a ton of budget by using short-term medical. So protect their out-of-pocket exposure, okay? Just a quick review. Remember, Aetna, Open Choice PPO, or Cigna Shared Administration PPO networks are the networks. Multiple plan divisions, you can go up to 3 years, right as young as 60 days old, and make sure you're directing them to use the $50 urgent care, okay? Amazing, amazing stuff there. I'm going to pull up the Q&A, although I'm imagining I answered most of it, but we did answer that already. If you guys have any additional questions, you can type them in the chat. I'm going to run through it now. If you don't, that's everything. So great job, guys. I wish you the best out there selling. We're pumped. Short-term medical's back. It's going to be a pretty wild open enrollment here. So have a great day. I'll answer the questions that are in the Q&A right now as I'm going through if there's anything relevant I need. But if you don't need those, have a great day, everybody. Nope, we already answered maternity. Yes, Lila, they would pay for doctor's visits on the plans. If they went to the doctor, it goes to deductible and coinsurance. Cool, thank you. Illinois flat out banned. Yep, Illinois flat out banned. Short-term medical is what somebody said. Yep. Why is Cigna so bad? That's an opinion, Rob. What if they get pregnant after on the plan? Maternity's not covered if they get pregnant after they're on the plan, so we would want to look to move them to an Obamacare plan at the earliest convenience. No, sport injuries are good, Nick. We'll pay for sports. Not a big deal. Kids can play sports. That's not hazardous. That's just sport. Now, if that sport that the kid played was equestrian horse jumping, that is considered hazardous. If it's snowboarding down black diamonds, that is considered hazardous. But no, for your normal kids' sports, those are fine. There is no difference in commission on payment options, Andrew. So write the right thing, do the right thing. Thank you, guys. I see no other questions. Wish you all well. Good luck selling out there. Hope you all have a great rest of your day and a great weekend.